You and I were talking about this off the air in a phone call last week, and it's just one of those things that I kind of hate bringing up because it just adds publicity to it. But I understand in this audience it is the right thing to do. But the story was from Alabama, and then I understand now maybe even in Arkansas, but the dangerous effects. And did you ever figure out how to pronounce this, being the esteemed doctor?
I pronounce it Tianeptine. It's pronounced a few shades of that, but Tianeptine I think will do.
Tianeptine?
Yeah.
And now, first of all, what is it? What is Tianeptine?
Well, Tianeptine is a over-the-counter, for lack of a better word, antidepressant. It's approved in some countries in Europe and Asia and Latin America as an antidepressant, also used in treating anxiety. At least that's what it's reported to do. It's not approved in the United States as a medication. On February the 23rd of this year, just 6 weeks ago, the FDA put out a warning on this, and our health department put out a warning last week to notify physicians and other healthcare providers around the state that Tianeptine is out there and it's dangerous, and we need to keep our eyes open and look for it.
Is it also plant-based, like maybe kratom or something like that?
Well, everything in one way or the other comes from a plant. It's an atypical antidepressant, but interesting enough, it binds to the mu and delta receptors. Now, you've heard us talk about that during the opioid crisis time and time again. Through modern science, we're able to identify different receptor sites, and we know that there are receptors for nicotine, for sugar, for alcohol, and for opioids. And the main receptor is the mu receptor, and this over-the-counter drug, for lack of a better word, it's reported to be also a food supplement, but the FDA knocked that out too. Binds to the mu receptor and the delta receptor, and it causes the release of dopamine, which gives you a euphoric effect. So
it will calm you down. Is it in pill form, liquid form, or how does it? Where would you find this in the fast food place, or rather in the service stations?
Well, most of it's ordered online, and it comes in powder, capsule, tablets. It comes in liquid. You can melt it down and shoot it up. You made reference earlier to gas station heroin, and I was thinking how many people out there even know what a gas station is. Those don't exist anymore.
That wasn't me. It was called that, gas station heroin. But nobody knows what a service station is anymore because that's the farthest thing from it. Sure. In this state. I mean, you got to go to Oregon for that.
This drug is also reported to be what's called nootropic, meaning it supposedly increases cognitive enhancement. In other words, makes you smarter. It's supposedly a smart pill. But what we have found is that it causes confusion, sweating, fast heartbeat, what we call tachycardia, high blood pressure, nausea, vomiting, agitation, sleepless, and in large doses. And that's the problem, is no one takes it. Almost no one takes it as it's supposed to take. You're supposed to take one tablet 3 times a day, which is 37.5 milligrams a day. The last patient I had was taking over 1,000 milligrams a day.
Of this stuff?
Yes. Yes.
So you've had patients that actually were using this?
Oh, yes.
Were they, and I don't want to give away any information here, but were the patients addicted, or have you seen addiction to this?
Oh, yeah. And the patients that are addicted to Tianeptine will tell you, just like they do with kratom, they'll tell you that the withdrawal coming off of this drug is more more sickening than coming off of heroin or morphine or even fentanyl.
Yeah, for how long? Maybe 6 days, 7 days, 2 weeks, 2 months? How long before addiction sets in?
Well, the acute withdrawal symptoms can come in effect in 36 to 48 hours, but you go through the withdrawal for 6 or 7 days, and then you go into a craving stage that might last for months.
Is this coming from China, like a lot of other stuff that comes from, or is it all over the place?
Oh, it's pretty much all over the place. I don't think it's coming exclusively from China. It's my understanding that Alabama scheduled it recently and made it a Schedule 2, and Michigan, I believe, and some other states are looking at Michigan and Minnesota, and New York are looking at outlawing it altogether. There's a number of countries that have outlawed it. I think Pearl River County in Mississippi, as I understand, has outlawed both kratom and Tianeptine.
Is that the only county in the state that you know of?
As far as I know, but I could certainly be mistaken.
It is amazing because you never know what's coming up after this. I mean, where do you get to a point where we've gone through all of these things and that they're actually showing up at some service stations, convenience stores? But, I mean, we've heard the story that I read said that you can find it in some of the convenience stores as ZaZa, Z-A-Z-A, or Tianna Red.
Oh, it's Tianna Red, Tianna White, several different Tiannas. I think Tianna Green. There's a convenience store in Oxford, and I don't know the name of it. I don't know where it is. I just know that that's a hot place to get it. There's several places in the greater Jackson area where you can get it, and it's just over the counter. And it's up to the discretion of the individual that's running the convenience stores whether they sell it to you or not. So conceivably.
Well, there's no age limit on them. A 13-year-old could get it, couldn't it?
Well, a 6 or 7-year-old. If you can reach the counter and put your money up there, just like with Kratom, you can buy it.
Yeah. Is because you said something a little bit earlier, is it sold to you as a middle booster and people don't know what the side effects are, or is it an enhancer to keep you awake or something like that?
It was initially sold as a dietary supplement, and the FDA came in and kind of shut that down, said you couldn't call it that. So now it's sold more as an antidepressant and an anxiolytic. In other words, a medication. They call it a medication that treats anxiety. And in low dosages and in appropriate dosages, it may well have some effect on depression, but people don't take it for that. I mean, you don't go to a convenience store to get your depression treated. You know,
would a physician offer you something of comparable strength or something that it is approved that would match that as far as depression is concerned?
Oh, sure.
They would.
There's many antidepressants out there.
Yeah.
I mentioned earlier that it's structurally similar to tricyclic antidepressants, and the one that you might have heard of, have been familiar with, is Elavil. It's been around forever. Mm-hmm. But we've gone away from the tricyclics into drugs that are more efficacious and have less side effects. And that's what you want from any medication. You want something that works and has minimal side effects. Well, this, first of all, doesn't work. There's no science behind it, and it has some very deleterious side effects.
You're not a big fan of Kratom either. I know we've talked about that.
No. And it's unfortunate.
And we still see people who've been hooked on that in the state of Mississippi.
Sure. Well, Representative Yancey and Creekmore and Nick Bain did an excellent job on getting a bill through the House this year, and unfortunately it died in the Senate to outlaw Kratom. I think it's a travesty that you can go into a convenience store, which is literally 50 yards down from my driveway, and buy Kratom or Tianeptine, for that matter.
Yeah. Well, it's almost like trying to keep up with these guys, because we did this. We had a session, quite a while ago, and I forgot what it was, bath soaps. Was it soaps?
Salts.
Bath salts. Yeah. Bath salts.
Yeah.
Not soaps. Bath salts and things like that they were sneaking in, and all kind of synthetic stuff. So Tianna Red, if it's called Tianna Red or Tianna White or whatever it happens to be, ZaZa, you see it happen to be in the medicine cabinet of your home from your teenager, then beware. And you said the withdrawal from addiction on this one is as bad or worse than some of the other things.
According to the reports that I've gotten from the patients that I've taken care of. And another thing that happens, you develop tolerance to it. And tolerance is a kind of a medical term that means you start taking 1 or 2 pills, and after a week or so you have to take 4 or 5, and then you have to have 10. You have to increase the dose to have the same effect. While
I got you here, can I ask you what your overview of the session is?
Well, I think
any medical bills?
Yeah, I think they accomplished a lot.
Hold on, don't go anywhere. It might be raining outside.
No.
Stall a little bit. We'll have another segment with Dr. Randy Easterling coming up next. Go home. Let's get back to Dr. Randy Easterling. I had a question on C-Spire text line. The effects of alcohol on this one. I guess if you're combining alcohol with this drug out there, the ZaZa or Tianna Red or White or whatever it is, I'm sure the consequences are going to be even more dire.
Sure, you get a synergistic effect, and that's another problem we're having. People are taking these with benzodiazepines, they're taking them, which would be Xanax and Valium and so forth, taking them with alcohol, taking it with opioids, and all of these are central nervous system depressants. And when you bind to that mu receptor site, sooner or later, if you take enough of it, you're going to shut down the respiratory system, and you go into coma and death. There's been 6 recorded deaths from Tianeptine, 3 in the United States and the other 3 in other parts of the world. That's that we know. Of course, a lot of deaths, we this stuff is involved in it, and you just don't know it.
When you look at the medical profession in our state, I'm going to switch to politics a little bit as far as nurses and everything else, and you follow the session both politically and just as a regular individual and citizen, but when you look at what went on as far as the ARPA money and some of the things that we've done, and you just heard the lieutenant governor, what's your overview of the legislative session?
Well, I think it certainly was a good session. The teacher pay was so drastically needed. When my daughter completed her first master's degree, she has 2, but when she completed first, she moved back home and taught in Mississippi for a year. Her starting salary with a master's degree was $31,000 a year.
Wow.
And the only way she could make ends meet was to live with her brother and rent a room from there. That hopefully has been turned around. Roads and bridges, money for roads and bridges are drastically needed. I mean, as we all know, we're still keeping our fingers crossed on the postpartum bill. Hopefully, the House will get to vote on that today. It's just we have got to do something to help our working poor. I got a phone call yesterday from a patient of mine when I was doing full-time family practice. He works hard. He works 12 hours a day. He can't afford any insurance, and he had some pretty ominous symptoms. He was calling me. He was short of breath. He had some swelling, and it sounds like he probably has a cardiac event. And I advised him as to what to do. But if he goes into a hospital, which he's probably going to end up there, his bill could be $50,000, $60,000, $70,000 for 3 or 4 days. And he on his income, he can't afford that, and he can't afford insurance. So those are the people that the postpartum, I think, is tagged at. It's not putting additional people on Medicaid. It's just allowing mothers after 60 days to continue to be covered till the year. 37% of postpartum deaths occur after that 60 days, between the 60 days and the year. So we'll keep our fingers crossed.
So, let me give you some one-word starter conversations here. The word is centene.
Mm-hmm. Well, managed care, managed care or managed cost organizations are not on our Christmas card list, generally speaking. And I think that what happened with Centene, I'm surprised that they got out with just $55 million because they stole a lot more than that. And I think that needs to continue to be looked at. Becky in the House has done a good job at trying to examine that and bring it to light. And people have to realize that the only way these managed care companies make money is by denying care to people. That's the only mechanism they have.
Yeah. By and large, I don't think the medical profession in this state has any great love for Centene because of the way they've handled this over the years. But I was a little surprised at the Senate going on and rubber stamping that for the most part. BS or BCBS, Blue Cross Blue Shield. Your thoughts?
Well, I was having dinner Friday night, my wife and I and another couple, and an old friend of ours came by, and they had their grandson with them, beautiful little boy, he's almost 2 years old. And he was born with this very significant condition, and he's getting treatment at the University Medical Center, which is the only place in Mississippi he can be treated. Now, I didn't ask them, do the mother and father have Blue Cross Blue Shield? I didn't get into that, but there's a good chance they do. Well, what's going to happen to that little boy? If he can't get the services of the medical center, and actually they gave him an IV treatment for the condition that cost $2 million. But it was covered by a grant because they were doing some research on it. It's covered by a grant, but everything else wasn't. So if perchance they have Blue Cross Blue Shield, that door could be closed for that child. And what's the benefit of that? I mean, that makes no sense. Well, I suppose that was your grandchild or my grandchild or your child,
It just seems to be some contractual agreement when you go to a hospital, and I hate to say this, with the insurance company and with the hospital, that you made that agreement to go in based on the insurance, and if somebody yanks it, somebody else ought to be responsible for that one way or the other. But that's a battle for the courts.
Just an observation, it appears that when we try to do something really progressive in medicine when it comes to reimbursement, something that would benefit our patients and the citizens of Mississippi, it appears more often than not that Blue Cross Blue Shield is on the other side of the fence. And
I was had a conversation yesterday with Tim Moore off the air yesterday afternoon, and I was just trying to toss this thing back up, and I said, I do not understand it, because this is not the first time UMMC or the contract situations come up with Blue Cross Blue Shield. And why, you negotiate till the last minute, and then this happens. There were some people I thought out there that thought, well, they're going to come to an agreement. They would not do something this dastardly. Well, that didn't happen. So now we're in this fix. So why, just trying to figure out exactly, why don't we have another company? Why isn't there more competition? And I think we came to the position that we are not attractive enough to get more people in here, combined with the power of Blue Cross Blue Shield. Would you agree with those two things?
Yeah, and when you look at other states, Alabama, for example, I believe the last numbers I saw, about 85 to 90% of working people that have health insurance related to their employment have Blue Cross Blue Shield of Alabama. So it's a formidable force. But according to Dr. Woodard, who I have a great deal of respect for, Blue Cross Blue Shield is simply saying you're just one other hospital out of hundreds in the state, and that's really not true. University Medical Center is unique in and of itself. It's the only teaching tertiary care level 3 trauma center, or level 1 trauma center, only teaching hospital in the state, the only children's hospital. If I get real bad sick, that's where I want to go, and people are transferred from all over the state for that. So,
yeah. Doc's always good seeing you, sir. Appreciate it very much.